Now invite Mr. Ramdev from the. Mr. Ramdev is the head of business development, healthcare solutions at Tata Communications. He has over 20 years experience in IT infrastructure and managed services. Now with Tata for about 11 years, and he is currently spearheading this initiative of Tata Communications into the digital health sector. Over to you, Mr. Ramdev.
Thank you. Thank you very much. And with that, I would like to take 2 minutes, introduce about Tata and the initiative, and then we move on. Why Tata Communication fit in, or rather, why should a communication department, logical core component company, get into a digitalization solution? Yes, the strength that we had initially built up against core telecom, then data center and security. That is when we thought, when we have this core competency of, right, including all your, as a
I can't
telecom.
hear anything.
Sorry?
No, you are quite audible, Mr. Ramdev. Please go ahead, sir.
No, because I can see.
Today, Mr. Ramdev is audible. Go ahead, sir, please.
So we as a Tata Communication, we thought that more important factor is connecting your, network, connecting this solution as such, like, hosted in a data center, which is secure, HIPAA compliant, plus also have a vertical based. When you say vertical based, a business vertical based solution, that is when in 2012 Tata Communication ventured into telecom. We have 8 years of experience. We have come across various products in healthcare, digital healthcare. Even though we did not market it at the full fledged, this is the first webinar in which we are showcasing our product. We have done pilot in all the products across. Let it be HAMS, let it be E-ICU, let it be a mobile van solution. However, in telemedicine and teleradiology, we have launched our product 5 years before. We have experience about 300 plus virtual clinic in very remote places. The remote places, when I talk about where the locations of about 1,000 people reside, right? So with that, I would like to get into our agenda. What is our objective is, how do we make sure an effective digital solution with an end-to-end managed service? Along with that, we ensure that we have an HIPAA compliant data center, 27,000 certified data centers, so that from a perimeter till an access is being taken care from a security point of view, which just not validated by our internal stakeholder, which is also validated by a third party like ENY and other service providers to ensure that we comply all our security parameters. Along with that, the new update that we are working with the National Health Authority, through which we also closely working on an NDHM compliance, which is going to be the new norm for India. India in health sector, we have various health services related procedure, policies for hospitals, bodies to control, like one of them to support such consultation service to establish an hospital. But to get into digital, are we ready? Is our application ready? Do we have a platform? The question is, at this moment, at least when we started, this pandemic has taught us a lesson that are we ready as in India from a platform, application, etc. Interprobability, are we ready with? We were not. We understood that government is supporting, various other stakeholders are supporting, with by which Tata Communication are coming up with an experience in healthcare. We are coming up with a platform closely working with NDHA compliant, by which the new norms and policies would be taken care and a cloud-enabled solution. We are not just doing that, okay, we are a technology company, let us focus only on technology and provide a solution. No, we wanted to make sure that, do we have a clinical process? That means we are working with internal and external. When I say internal, Tata Group also has few doctors. When I say few, the numbers are 500 plus. So few doctors who can give their clinical approach. We are also working with reputed colleges like Pijmer, Jibmer and all this, who can give a resource or a knowledge to test this, to validate it. And we're also working with various colleges and hospitals to ensure that this particular product gone through a clinical process. So effectiveness is for doctors. It is not for a technology and an IT guy who is going to operate this. Healthcare provider. When I say healthcare provider, the core effective the front end here are your doctors and nurse and assistants. So can we focus the solution towards them? That is when our users and the testing users and MVP users are doctors, nurse, and clinical process. Hosting, I'm saying we are not just giving an application, we are also having a paramedic in a virtual clinic as an example. We are providing paramedic, we are providing doctor for the consult, apart from all your network, hardware and software, cloud solution, etc. We wanted to ensure that the cloud solution being effective from a pricing point of view, access point of view, from a security point of view, and enter as a solution provider. With that, I would hand over to back to our friend Alex.
I'll take it and then.
Yeah, thank you.
Thank you very much, Mr. Ramdev. We now come to our first session. Our first session is on E-ICUs and E-ambulances. Our speakers for this session are Dr. K. Surya Prakash. Welcome, Dr. Surya Prakash. He is a critical care specialist and a diabetologist, presently with Sakthi Hospital at Chennai. He is an MBBS and MD in General Medicine. He has an FICC and a PG diploma and an active proponent of E-ICUs. We also have Mr. C.S. Ramakrishnan from Acme side. He's our CEO and our chief consultant. He's a postgraduate from IIT Kharagpur, heads Acme's projects in both process improvement, quality accreditation over the last 14 years, and is definitely considered as one of the foremost. Ramakrishnan is now quite focused on how best to adopt digital technologies to solve India's huge shortage of critical care specialists. The reason for his passion with the adoption of. Over to you, Mr. Ram, and over to Dr. Surya Prakash.
Thank you. Thank you, BG. Welcome all participants. Today, the first and foremost topic connected with this technology-related product being E-ICUs and E-ambulances. Today, many of you must be already aware that as an alternative to the critical care support that is being provided at the hospitals, today E-ICUs are gaining popularity mainly from the point of view of very good real-time monitoring possibilities, where the patient related feedbacks and particularly patient conditions are relayed back through use of technology to a central place where specialist doctors provide the necessary support. And today, with the advent of these E-ICUs, even remote places have a possibility of being well connected, of providing critical care support. And today, with the added backbone support of telemetry, electronic medical records, etc., today even the early warning signs of patients in ICUs can be relayed back to a team of specialist doctors, where they could provide the necessary inputs through video or other devices, and people at the bedside, maybe junior doctors and nurses, they can provide the necessary support. And E-ambulances today, where the hospital needs to provide referral services to other hospitals, patients are being transported in ambulances. E-ambulances come as a very handy support, wherein the patient condition is relayed back well in time to the upcoming hospital, where even any critical requirements like a CPR, etc., could be provided online. And also the hospitals could prepare themselves up to receive the patient well by knowing the patient condition and the requirements of any surgery, etc. So this is becoming one of the major boon to the technology related enabled services that the hospital can make use of. So I have with me the expert Dr. Surya Prakash, and from the technology side Mr. Ramdev, who would be able to explain on the nuances of this technology further. Over to Mr. Ramdev.
Thank you, Ram. From there, I would like to talk about E-ICU solution. Now, why E-ICU solution is important? Tatacom has thought through, and along with, as I mentioned you, along with our technical experts and the clinical experts, we have devices already established in various sectors. Like many hospital has devices which can monitor the patient, and there is a controlling nursing room or a console is available. But how do we enhance? What is the more critical element here? Do we have can we reduce or can we improve an effectiveness of a clinical decision process? When I come back to a decision, what all element that is required? With the doctor's help, I would request Surya Prakash to talk about what all the importance in E-ICU. Then I will explain about the solution. Doctor, give us a few talk about in E-ICU. What is important for you to take a decision?
Dr. Surya Prakash?
Dr. Surya Prakash, you're mute, sir.
Yeah, is it audible
Yeah,
now?
is there? Yeah, it's audible, sir. Please.
Thank you, Ram. Actually, the concept of E-ICU is developed to reduce the time delays and the diagnostic time taken by the other remote areas where the specialist consultants are not available. Even the junior consultants are able to manage the patient with the help of the senior consultant and senior consultant experience. So that's the basic E-ICU, and we can track the patient, how the patient is going, because nowadays getting a critical patient from a rural area to an urban area is going to be a tough time, and we may lose the patient at any point of time. So the concept of E-ICU is developed only for the benefit of the patients. So all these digitalization of health, what we are talking about, it's all mostly concentrated on the patient safety and patient service improvement. So mainly the E-ICU, what we are talking about is getting the tertiary care, or you may take a tertiary care healthcare professionalism to a rural healthcare setup, or to a semi-urban area also. So in that way, the patient will be more benefited, and the treatment of the patient will be better. Even though the junior doctors are there, they can get training with the experience of the senior doctors.
Exactly.
And this is
That's
basically the concept. That's what we actually do. What we actually do is we have a video consultation kiosk where we get any patient, means we directly connect the senior doctor or a cardiologist or a gastroenterologist or a neurologist. So whatever the neurologist said, we do the CNS examination according to this thing, and he will be able to guide us.
Thank you, Surya, Dr. Surya
Yeah.
Prakash. So you
Yeah.
mentioned here a most important factor for a doctor to take is a decision based on one, patient status, patient clinical process. When we say clinical
Yes.
process, could be a medicine, could be an attender or an injection or whatnot that he's going through, drugs that he's going through. The next is a procedure that has been gone through already, and you need an immediate attention by a various other specialists. It could be neurologist, it could be gastrologist, it could be ABCD. Why? Reason is, can I take a quick decision in changing the due course of, because when you talk about ICU, an ICU are prone for an infection, which you all know, right?
Yes.
So how do we faster, quicker enough to ensure that the technology can enable? So do you believe, sir, doctor, as you all know, I don't want to make sure that the technology always help, but you think a technology will really help in this case?
Yeah, definitely. Because I'll tell you one good example. We had a patient of 23 years girl who came just with fever and weakness of both the lower limbs. Like it's a Guillain-Barré syndrome. Actually, it was diagnosed from the emergency room by making a video call consultation with the neurologist. And the neurologist is good enough that he is able to assess the patient through our junior doctor neurological examination.
Wow. Okay.
That's great.
And the diagnosis, we got it very fast, and the patient is benefited. And she is a government employee. She's a Tamil Nadu government employee. She came with 1 day fever. She's working in Irlagam, and she's saved with that. Wow. Unfortunately, the next day she went on to the ventilator. She went into respiratory paralysis and all, but she came out. By the time we started on, So this always helps the patient.
So now let us talk about, we build hospital, we build E-ICU, we build equipments, we build a process, we build what do you call that, as a connecting devices and a resource to manage. One, it could be an IT resource, it could be a clinical resource, it could be a doctor, super specialist. But to manage all of this, you need to have an interconnected, so that the information flows in a proper and in a required and an appropriate manner. Isn't it, doctor?
Yes.
Okay. So with that, Glowhill has come up with an E-ICU solution that we are testing with various institutions. 1 or the 2 is in a successful parameter. Why do you want to test this? What we understood is already many hospitals are invested on equipment. So what we should do, an equipment which is already monitoring a patient, can I bring it to a central console? In most of the cases, they are doing it. But is it enough? No. Once a centralized console is there, can I interlink with HAMS? That is possible? Yes, it is possible. Along with that HAMS integration, to know the patient, chronic illness patient and his previous history information, we need that HAMS to be integrated. Now, is it enough? No. What we added is, again, we have added something called a component of ICU management software along with HAMS. Why it is required? What is the current status of the patient? What is going on with him? What it is actually a current medication, like 4 hours, 8 hours, 16 hours, and what are the radiology and pathology report that he's going through on a daily basis, and what is a medical device parameter. So that is where we have stitched E-ICU solution and your telemedicine, a virtual clinic solution all together. Why you need a telemedicine solution here? When there is a spike which has been observed, can I treat the patient or see the patient immediately? Can a doctor get the alert immediately? Can the central nursing station can get the alert immediately? If these all are available, can I have the patient attender wherever he is? Because that is when the patient gets benefit. Because when you talk to patient is already in a panic situation or in a not in a hearing situation, or he may be in whatever stages he is into. Can I have the attender available? So these all are process required. Why? If I have to change a medication course, if I have to take an immediate test, if I have to do an immediate surgery, if I need an immediate attention of a neurologist, gastrologist, whoever not, can I connect immediately? This particular software can help connecting. Along with that, a data and algorithm. An algorithm is effectiveness. Why algorithm would be effective? We know this is the threshold of the patient. Once the threshold has been set, beyond the threshold, if it shoots up, even if it is a twice a hour or twice in a minute, a BP or any other fluctuation in the report is going up, including an incubator, please alert it so the doctor can change the medication in due course, which can enable a patient recovery faster. The most important is the monitoring parameter would enable connecting all the work group at one instance. So the time is saved, the treatment could be faster. And I'm sure doctor has mentioned that you can develop any other process, etc. But if you're not giving the information at an appropriate time, and that to an appropriate information, along with some analysis, which can help doctor to take a decision faster, that too, especially in emergency case, bang on, I'm sure the E-ICU solution would be a valid or a better solution for the environment. Provided we are coming up with few more algorithms, which I'm not going to discuss in length because that's going to take 30 minutes more. I'm now handing over to Acme, our consulting firm, to take it further.
So I think the point that Mr. Ramdev highlighted, today we see even in NABA that the requirement to have multi-speciality and multi-speciality consulting inputs, which are basically the need of the patient ultimately. So today these are the aspects which are being integrated into the patient's record also through your EHR, whatever that are already available. And most importantly, the depending on the patient condition, you are trying to bring in the patient's acceptance also, because today patient is normally carried away by the equipment that are tethered to them literally. So today it is these services which are lined up together as e-services, where the specialists are made available where there is a need, and there's a central team helping to analyze the data that are coming in from various monitors, which are pooled in together, so that any quick responses that are required to be put in place, they are appropriately given. So I think this is a very major technology related advantage that the hospital will definitely come up with. And in addition to that, wherever the patient to be managed remotely, then we are talking about the ambulance services. I think it has got an extension of similar your ICU beds, where maybe you can explain the additional feature, Ramdev. I think this is also going to be one of the major things when you talk about referral related things, or patient being transported for next higher order centers where they need to be exposed to further procedures, etc. How the interactions take place.
Thank you
Mike
so
is,
much.
yeah.
Yeah, thank you so much, Ram, for asking this question. While when we talk about e-ambulance solution, which have already been effectively used by various sectors, but what an advantage of when technology team like Tatacom getting into such solution is, we manage an end-to-end, what do you call it, a communication. When you say communication, it is not only a network. Communication is, does the data talk? Does the data gives an information to the patient, or sorry, doctors, and including the support workers who is actually picking up the patient at the remote place who needs to be transported? What that clear indication that, but still we are working on certain clinical process that could be advised. But the effectiveness, what we are bringing in is the communication layer, because that is our core strength. And also we are coming up with a technology, which is a software. So how the data transfer happens when you have a limited bandwidth, when you are in the mode of transferring from a one, because when that ambulance is passing by, it has to pass through various endpoints, which I'm not going to discuss in depth. But the technology support that we are bringing in, the augmentation, the automation that we are bringing in this particular software, what it does, we have one example with one of our pilots that we did with an hospital. When the patient is picked up, when he picked up, along with this paramedic support, he had an immediate network disconnect. And you won't believe, we had a software, which is the use case was the interconnect, the connectivity between the stages that is moving, a van is moving from one place to another, that is not effective enough for us to get a good throughput, etc. And a devices that is integrated. Earlier, they had multiple devices, but the data was not streaming. Appropriate data were not streaming to the doctor, and he was not able to advise. We did a pilot for at least 3 months. Our effectiveness, I don't want to tell about the use case, but 98% was our effectiveness. We were also need to improve into, of course, yes, there are a few cases which we are doing. But what I want to summarize, one, when you have an E-ICU solution along with this emergency ambulance, or sorry, that call about e-ambulance solution, and the clinical process will start at the pickup, or when you say at the stage of when an attender is picking up a patient and an ambulance driver is picking up a patient, he gets the support from there till you're part of a journey till an ICU and his recovery stage. With that, I would stop here and hand it over to you, sir.
Would the panelists like to take a few questions at this stage from the participants? Ram, can we take?
Yeah, we can. If at all anything is there,
Yeah.
we can try to.
Yeah, there is.
I saw somebody raising an issue about security aspect. I think maybe you can read that out.
Yeah, there is one question from Atmala Suresh Babu explaining that what could be the control of security threats in this new ICU. Would Dr. Surya Prakash like to take this? Dr. Surya Prakash?
Yeah.
Yeah. Any security aspects that need to be taken care of in an E-ICU? Security,
no, as a normal,
yeah, go ahead.
Normal routine spyware, this thing, and that should be there. There is no other security threat as such, because your data is intact within our loop only. No.
Yes, I think that Tata has got all the.
I think the user authentication, etc., must be available. I'm sure from there, right?
Yeah.
I wanted to give a two information about it. Yes, the security is a high essential matter that we have to focus on. One, as Dr. Surya Prakash said, that is there any attack to your platform which has already been taken care, being Tata Communication having their home data center? That is what he was trying to mention it. When I come back to a consent form, or our entire solution has a consent form in each consultation. Also, when we get into these, or like when the nurse, it could be a duty doctor, it could be the specialist, those who are going to attend through the technology will be taken a consent form, so they do understand the sensitivity of the data. And the next is the data that we have already, our platform is HIPAA. So those who access, apart from the hospital management, the data will be encrypted when it is being stored in our data center. So no one can directly see any information related to the patient age, sex, and all that, the clinical process that they are going through.
I think, yeah, that pretty much puts to rest any security issue they have on data. Then a common question that's coming up now is what government approvals does this E-ICU? Dr. Nitish has asked the same question, and there is one more question also on medical legal. Dr. Surya Prakash, any how do you think we can address that? Is there a legal issue, government issue?
Medical legally as such, now there is no binding actually. Medical legal we don't have, because until now it's not being recognized even by the insurance also. No insurance will recognize your E-ICU treatment or any teleconsultation or anything. So we're just still on a discussion with the insurance people. So medical legal problem, yes, patient documentation, the documentation by the super specialist and all, that can be taken care of. But we didn't face
we understand a lot of American hospitals using E-ICU in a big way. There are even some players in India who are monitoring hospitals in the US. So if an NABH or a JC accept it, I think legally they should not be applied.
Even we have a consultant, one person from New York, one person from Australia, who will be managing our ICUs for short times. So there is no legal binding at all.
There's no legal problem as such. That's what you say.
Yes.
I think that addresses that.
Yeah.
So if in that case, can we move on to the second session? Is there anything else that Dr. Surya Prakash or Mr. Ramdev or Ram you would like to say? Or can we move on to the next session?
I think so. There are various questions coming up, but we are short of time.
We can take whatever question we are not able to cover in this time. We have about 3 minutes left, Ram.
Yeah.
There is one more question from Tirumala Hospital, Vijayanagaram. As per the quality standards of NABH, verbal instruction by a senior consultant has to be documented by junior doctors, and the same has to be signed date and time when the consultants are with the patient. Is the same thing applicable for the patient in ICU?
Yeah. So I think relating to time element, everything, these are all captured on real-time basis. So time element very much being there here. And the other element is with respect to maybe the clinician signatures, and I think electronic signatures are enabled in all this. So I think whomsoever has been providing the intervention, I think there is electronic signatures available, and consent related, which is another major legal thing which normally we talk about any intervention that has to be provided. I think that is also being, because you have got the communication, this thing is there, oral, this thing is taken, which is also recorded, I think. With these elements, it satisfies all the requirements of the major consent related requirements also.
So with proper controls and proper documentation, there should not be an issue from an NABH or even a JC accreditation side.
Sure.
Okay. I think any more questions that come, we will take it after 6 o'clock because 6 to 6:30 we have kept entirely for Q&A alone. So I thank you, Dr. Surya Prakash, very much. I would request you to join back at 6 if you can.
I'll be switching off my video, but I'll be online.
Very good, sir. If you have any questions, that
very much fine.
Thank you very much, Mr. Ramakrishnan. And Mr. Ramdev, I'd like you to hold back for the next session too.
Thank you, sir.